The aim of this presentation is to describe, using a case study, the intersections of social spatial issues and health equity for school children with asthma and other invisible forms of disability from the interdisciplinary perspectives of architecture, nursing, and disability access. In this presentation, we will cover two areas: the asthma care provided by school nurses, and second, the geography of asthma care in the architectural design of schools. What is the problem with the way we are designing school environments with respect to the voice of youth with disabilities? That we haven't really thought carefully about how to position the youth with disability inside the conversation around school design. There's two components of this. They kind of erupt from critical disability theory. The role of the school nurse. What school nurses have done for children with asthma has been mainly to focus on indoor air quality and outdoor air quality. That's from outdoors, from car exhaust, from school buses, diesel school buses, from wildfires, from being close to freeways. And indoor air, certainly very popular complaints about mold, ventilation, off-gassing of different cleaning products inside the school environment that can affect children's ability to be able to concentrate in school and also trigger asthma-related events. But what's interesting inside school nursing with relation to critical disability studies is that nursing itself has been sort of behind the curve in terms of really talking about critical disability studies inside the theoretical work that nurses are doing. Nurses have mainly located themselves in a biomedical model of looking at the individual with a condition, with something that impairs them. Critical disability studies doesn't work from that impairment idea. Our practice in terms of how school nurses are supposed to practice with people with disabilities, most of the national policy documents are silent in terms of how school nurses work with youth with disabilities. And largely, what school nurses have been involved in terms of the schools, have been involved in health room design, not necessarily building design for kids with disabilities. So that's what prompted us to problematize this and think about what sort of policy solutions and what sort of strategic directions designers and nurses and academics should be moving forward in terms of thinking about this problem of the youth with disabilities inside a school environment. Judy Olson, BA, RS, and a certified asthma educator for County Public Health Department.
You know, everywhere, we want children to be healthy where they live, where they learn, and where they play. And so that means involving schools and homes, and of course for a child with asthma, involving the healthcare system. The Public Health Department can serve as the bridge to connect the home to the healthcare provider, the home setting to the school nurse so that they're aware, and the school environmental setting to the healthcare provider.
Shelley Hobbs, RN, MN, School Nurse Leader, Urban School District in Washington, USA.
The care of children with disabilities for school nurses on an everyday is kind of a case management role. So our school nurses kind of oversee all the moving pieces. They're the liaison between the family, the school, the doctor's office, and they kind of pull the pieces together to ensure that health information is there and available, and then we can move forward with that piece. So as case manager, they participate on different teams to educate those staff members around the student disability and then help come up with kind of accommodations or supports the student might need. So the 30,000-foot view in my role as a health administrator, again, is to serve students across our entire district. So I have 30,000 children that I have to consider when I am looking at budgets and staffing and making sure that there is a nurse in a building to serve a child who might have a medical need, and is it appropriate?
I am very discouraged by the lack of school nurses in schools, by the funding cuts that schools are facing for the last probably 5 to 10 years, we haven't had school nurses in every school, and I think that that is not okay.
Nicole Klein, RN, PhD, school nurse leader, statewide, Washington State.
When I came into school nursing, I realized how powerless they were as nurses. I came from a hospital setting where nurses were decision makers. I mean, we were the last line of defense to make sure that our patients had what they needed. And I found that in the school setting, that was not the case.
Not everyone understands the role of a school nurse and the capacity that we can serve. We have so many skills we can bring to the team, and often when someone sees a school nurse, they think Band-Aids, first aid, ice packs, basics, right? They forget that we have kind of a higher level of education, and we can provide wonderful input for case management and the advocacy of children. Not every district has a nurse that oversees the nurses. So we are fortunate in our district that I could speak to their role. I've been in that position. I can work with them and kind of help us align with other departments. Some districts don't have that. And so the person who oversees them may not understand the work that they truly do and can't speak on a larger level about the capacity of the nurse. And then as a state, I think legislators need to come see what a school nurse does. Come to a building. Right now, for 30,000 children, the expectation is 4 nurses would serve all their needs. There's no way that 4 nurses can serve the needs of 30,000 children.
The way that schools manage invisible disabilities, such as asthma, differently is quite interesting, actually. There are state laws around life-threatening health conditions.
And so where that starts with the life-threatening condition is once they are identified, we do need to have a care plan in place, medication and orders before the child can enter school. So the school nurse, that is their priority. Get the safety pieces first so that we don't come to school and have the possibility of a life-threatening event. And then they partner with the educational team to look at those educational pieces that might be affected from their health care.
Asthma, as you may know, is one of those life-threatening health conditions that it's not always seen as life-threatening. It's very subjective, even for the patient. A person or a student may not realize that their triggers are from them running outside or just maybe having that teacher spray something that they probably shouldn't spray in a classroom that might trigger a student. The student themselves may not realize that. You have this perception that asthma, especially asthma, I would say especially asthma, is not such a big deal. Unless they have severe asthma. I would say, in my opinion, actually it's less life-threatening usually than kids who have intermittent asthma, because kids who usually have severe asthma are being constantly treated, and they usually have the medications that they need.
To a layperson who is not medically trained, they may not notice the child has asthma. And so it really is the school nurse who has to identify that child and say, this child has a condition that might affect the school setting, and this is why, and this is how we can support them.
So we have 2 community health workers who provide asthma support to families. Referrals may come from school nurses, so perhaps a child is coming to school and needing to use their inhaler a lot, or they're missing school and the parents don't understand why the child's asthma keeps flaring up. Or worst case scenario, the child has ended up in the emergency room or the hospital for their asthma. So at any of those points in time, somebody can make a referral to our Clean Air for Kids asthma program. And the community health workers are very skilled at talking with school nurses and explaining potential asthma triggers within a school, as well as communicating with healthcare providers to get clarity around the asthma action plan. And then they can translate that medical lingo into something that parents can understand and act upon in the home.
There's critical geography, and critical geography has taken on some of the exploration about design and environments, understanding spatial issues between illness and disability inside spaces. But what critical geographers have mainly done is they've taken on visible disabilities, right? Wheelchairs, crutches, canes, the things we think of as visible disabilities. But we haven't really tackled this idea of the invisible disabilities. And we have invisible disabilities relating to asthma. And in this particular case, we use the sort of case study of asthma to explain this. So the case example is set in the city of Seattle based on some photo voice research that I did working with African American adolescents and also had current asthma, meaning they had an asthma episode in the last year or had frequent use of inhalers. So we handed cameras out to about 20 kids, about half claimed female, about half claimed male. We did focus groups, selecting youth from this high schools in Seattle that are in the southern end of Seattle, right? So the segregated side of Seattle, if you like. And we asked them to take photographs of what asthma is like for them, what managing asthma is like, but we also wanted to understand how they thought about racial inequities and asthma. So the basic question for that was, what makes your asthma hard to manage compared to others? And they came back with a bunch of stuff. And one of the things we began to see is they're bringing back these photos of stairs. Stairs inside schools, there were stairs outside of schools, there were stairs up to apartments. And the youth talked about how stairs were important to them, like they helped them build their strength. But they also talked about stairs being kind of difficult for them, hard to manage, hard to breathe. One of the people said, it affects me on a daily basis. Or they said, I was late and assigned to Saturday school. So the children began to talk about these photographs of stairs. They said, yeah, I come to school and I got to climb all these stairs to get up to class. And then I'm late. Or then it takes me 10 minutes to catch my breath again, right? So I can't concentrate in class, so I miss half of the class. One of the youth produced a photograph. He called the photograph Walking All Day on the Steps. And he said, it's not a problem for me, but for most people I see, people get winded off of it. It is good exercise. We have more stairs down here in the South End, more stairs, more floors. And that set me thinking, well, is that really true, right? Are there more stairs in the segregated southern part of Seattle compared to the North End? So I actually went and did a walking audit of all of the stairs in all of the high schools. And what I basically found was that students in the south end of Seattle, they were climbing about 10,000 feet over the space of one school year, compared to students in the north end of Seattle who were climbing about 4,000 feet. That got me thinking that we are actually, we've got a problem with segregation. We've also got a problem with school design, right? School design that doesn't take into account children with disabilities.
As far as designing buildings, I think school nurses play a huge role.
I think that they are your most obvious health champion for a school setting. They are well aware of how what happens in a blueprint and turns into a building, how that impacts student health once the building is used and the students are occupying it.
School nurses need to be partner or involved at the beginning of designing buildings, essentially.
And typically, unfortunately, we're kind of the last thought, right? We're thinking about structure and space and basic needs, but then health is a basic need that's often not on the table.
They can pick up where they are, get involved in design teams if they're asked to be at the table.
So I think right now there isn't a large expectation around specific school design if you're speaking to like the layout of a building because of the capacity that they're already serving and how taxed they are. So I'm pulled in, but I'm usually pulled in at the end enough to say what supplies are needed for the health room, not where should the health room be located, what is the structure of the health room, and then we end up with buildings where our most medically fragile are across campus from the health room where the nurse is working.
So having school nurses involved up front could probably lead to some really creative opportunities to design a very healthy school. I think that the ideal change that schools could make in order to help children with asthma would be to think ahead. Again, knowing that you don't always know which child has a respiratory concern. So you need to treat the entire school as a healthy space.
Clearly, a lot needs to get done. Dr. Oswal and I suggest that the next steps for critical disability in school design move towards, number one, involving youth with disability in the design of school environments and the redesign of school environments. Often, as in the case study, those school buildings had gone through successive renovations and redesigns, but never have involved the voice of youth with disabilities. There's also a need inside this for a deeper understanding amongst policymakers and practitioners inside schools and inside the world of school health to more clearly understand the difference, the recognition of difference in bodies. Difference happens in a variety of ways. There is invisible disability in a variety of ways that we've heard. School nurses and public health nurses need to have stronger advocacy role in school design. There needs to be a resource rebalancing inside school funding systems now to empower nurses to have a greater role inside their schools. School nurses need certainly education on how to be involved in school design processes, as well as other public health advocates in and around working on systems of air quality and asthma inside public health systems, not necessarily in terms of school design. I think we need to expand the understanding of what school design means in terms of children with asthma, beyond just primarily concerns around air quality and environmental quality like that. Yeah, and then further on with that, there's this notion that we need to actually engage more research in disability-centered school design. Right now, when we looked for supporting work within this paper, what we found were largely a focus on visible disabilities and not necessarily all disabilities or all different interpretation of what a body is. Thank you very much.